Hello, my name's Iain MacRae. I'm an osteopath and I work in Brisbane at West End Osteopathic Clinic. I've been involved with osteopathy since 1993 and I treat a broad cross-spectrum of people from newborn to the aged. I originally trained at London at the BCNO and at the College of Osteopaths, where I received a broad training from a diverse range of prominent professors. I had my own clinics in Scotland. One was run with dentists as a multidisciplinary practice and the other one was purely for osteopathy, and they were really successful and worked well. My philosophy is to find the inherent health within a patient and to promote and restore optimum function. Osteopathy is a hands-on treatment modality aimed at treating the root cause of symptoms presenting at clinic. I utilise both a structural approach and a gentle cranial approach to try and encourage a patient's journey towards health. I have an interest and experience in both paediatrics, sports and general osteopathy. So examples of the type of things commonly seen in clinic would include migraine, back pain, whiplash, sports injuries. And in children, things like gluea, flattened heads, colic and general restlessness can be very effectively treated using osteopathy. I really like working with people and I treat with honesty, empathy and compassion. I realise my limitations, when to refer or when to treat. I have a people-centred approach to osteopathy and I try to get people better as soon as possible with as few treatments as necessary. And I aim to provide ongoing maintenance as required. One of the great results that I've had was treating a young baby that was suffering from severe restlessness and difficulty sleeping at night due to colic. And after treating that baby for a period of 2 to 3 weeks, the baby seemed a lot calmer, a lot more settled. The parents and the baby got a lot more sleep, so everyone was delighted. Another good example would be a mountain climber I treated who, prior to going to a trip to the Dolomites climbing, came to see me because he had a chronic ongoing low back pain and he was wondering if I could help resolve it. And to my delight and his, it turned out just to be quite a simple facet restriction in his lower back, which once released allowed him a far greater range of movement, and he was absolutely delighted with that.
Hi, I'm Luke. I'm one of the osteopaths at West End Osteopathic Clinic. I grew up in Brisbane and moved down to Melbourne to undertake the osteopathic double degree. And after 5 years studying in chilly Melbourne, I moved back to Brisbane for the lifestyle and warm climate. My main approach to treatment is that every person is unique and that education often forms a critical component to treatment. A 6-month-old baby is going to require a very different approach to an office worker who spends 40 hours a week at a desk. And of course, my approach is going to vary a lot person to person. As an osteopath, a consultation includes a case history of the presenting condition, an examination of the area and surrounding areas of pain, a diagnosis and hands-on treatment. Many of my patients go home with stretches and other advice to help with the healing process. I think what makes me unique is the compassion and empathy that drove me to become an osteopath. One of the great things about being an osteopath is the wide variety of conditions that I can assist with. A lot of the problems are spinal related, such as low back pain, neck pain and headaches, but I also see a lot of other complaints, such as hip pain, knee pain and ankle injuries. It is especially rewarding when I can help a woman through her pregnancy with a lot of the aches and pains that many see as unavoidable, as well as the recovery after the birth and with the infants if they've suffered any birth traumas. I think people like to see me for a few reasons. One reason is results. Pain relief is often a high priority for my patients. Another reason is for advice and understanding. It can be difficult to understand why an injury has occurred or why it has recurred over the space of months to years. I enjoy having the skills and knowledge to help a patient and explain how to reduce the risk of this happening in the future. One great result is a 45-year-old truck driver who had low back pain, which had been going on for years. He was overweight and had been told until he lost his weight, he wouldn't lose his low back pain. I was able to sit down with him and talk about ways in which he could lose some weight by exercising in ways which were pain-free, and even talked about his diet. He was glad to have someone who looked past his weight and to the person. Over time he lost his back pain, his weight, and now he couldn't be happier. I love using my training and experience to help people feel better. I couldn't imagine doing anything else.
If you're interested in our services or the care that we provide, please don't hesitate to give us a call at West End Osteopathic Clinic.